My name is Dr. Anthony Zuppardo. I'm a chiropractor here in Hammond. I've been in practice for over 40 years and have treated over 10,000 patients in that 40-year period. I'm here today this is Michael Beauvais, and as you can tell, he's not a professional actor. But he does have a condition with his hands. Show the hands one more time. He can't close his hand all the way. And there's a little bit of arthritis in his hands. Is that accurate, Michael?
Yes.
And in his hand, you can close a little better. Okay. And this little stick here, we're here for the purpose of showing you this particular little T-bar stick that a person can self-treat their own hands and help with arthritis. And that's the whole purpose of this video, is to demonstrate to people who have either osteoarthritis or rheumatoid arthritis how they can release tension in their hands. I want to thank Chester Forrester, the man who taught me this method at the Neuromuscular Massage Center, CNF Body Works in Baton Rouge, Louisiana. Chester taught me how to do this particular work, and I've been doing it for the last 10 years and found it to be very effective. I have Chester's permission to do this video. And this is made of poplar wood, and it's a T-bar. It's apparently glued into this top part. This top part is designed to release tension in the forearms, and the rounded part can dig into the muscle. But the main thing we're using for the hands and the wrist and the fingers is the little pointy level here. And so we're going to be demonstrating that in a second.
And okay. Part of the reason they're so expensive, they're making them one at a time.
One at a time, yes. Thank you. Michael, he knows how to make these sticks. He has a background in industrial technology. Okay, so when I feel the fingers of Michael's hand, I feel a tension and a knottiness in the knuckles. And you have multiple joints here. You have a joint here, you have a joint here. You have this joint, and this joint in the fingers, and surrounding the fingers are muscles and tendons, and it works like a little, you're like you were a puppet. There are muscles here. Watch my forearm move as I move the muscles, and I go into extension, and the muscle contracts. Now, when I go into flexion, the muscle contracts here, and this is called flexors, and this is called extensors. So bending the wrist back is extension, bending the wrist forward is flexors. And these muscles, when I move my hand, I don't know if you can pick that up, Paul, and you can see the muscles moving here and here. And we're going to release the tension in the hands. Then we're going to also demonstrate how to relax some of the muscles in the forearm. Okay, so this is pretty much, we're going to do his right hand right now, and I'm going to take this stick, and I'm using this point here, and I'm basically just going over gently the muscles, tendon, and ligaments in the fingers. Now, we're not curing arthritis when we work with this person. What we're doing is we're releasing muscle tension in the tendons, ligaments, and muscles of the fingers, and we're allowing that joint that we're working above and below this particular joint right here, this joint here, and we're releasing the tension in the muscles above and below and around that joint. So it's a slow process. Now, Michael does this on his own about once a week. Is that correct, Michael?
Yeah, I do it once or twice a week, but I haven't done it for the past week and a half. So
his hands are very stiff.
The effect of using the stick.
This is where Justin Wilson would tell you a funny story. Not Justin Wilson. So I can't think of any funny story to tell you. As he's stirring the pot of red beans in his cooking show. Now I'm getting the entire finger, and now I'm going to get the base of the finger. I'm going to turn that hand over, and I'm going to get, that's closing better, isn't it?
That's better already.
So I'm turning this over, and now there's tension all along here. from the wrist, really from the forearm down, but we're focusing on the hand and the wrist today. So here we go. Now this is there are muscles in here and tendons in here, and we're getting the palm of his hand. And this if you have a problem with carpal tunnel, this should not hurt you to do this. Now, there are contraindications to this method. If you're on blood thinners or on chemotherapy, this technique could bruise the fingers. And so you would just do one finger and see if it causes you problems to do it. And if it doesn't cause you a problem, if you're on blood thinners or chemotherapy, then you could go ahead and do a little bit more, do the other fingers. But as a general rule, the only thing I found that's contraindicated was I had a patient that was on chemotherapy, and it bruised his fingers. It helped his arthritis, but there was a bruising of the fingers from me rubbing the tissue with this stick. And I'm not pressing in. I start off lighter, and I can go a little deeper as I feel the stick glide gently over the finger. I can go a little bit deeper with the rubbing of the T-bar onto the finger. Now we're going to do his whole hand, and then I'm going to have Michael, I'm going to have you demonstrate how you do the other hand.
Okay. Yeah, before Dr. Zuppardo used this technique, I was getting ready for carpal tunnel syndrome, and I also have a trigger finger that it helps. But when I don't do it, it's when I have problems with the finger. Otherwise, if I do it once or twice a week, no problems.
And he's a Cajun, so he could be trigger happy. All right. The jokes may not be that good. The technique works. The jokes may not be funny. Now I got this side. I'm going to turn over. I'm going to do this finger on the top, like this. So I did the underside of that. Now, my mother is 95 years old, and she has very thin skin. So I have done this on my mother, and but I'm very, very gentle with her because someone who's 95, the skin is very delicate. You don't want to get too aggressive with an elderly patient. Now, I also get on the inside and what they call the inside and outside, a lateral and medial aspect of the joint. And I do the top and I do the bottom. And I usually recommend that the patient will sit down and watch the news and give themselves a self-treatment, because it's a time-consuming process. And usually most therapists do not have 40 minutes. This process will take 30 to 40 minutes to complete. And most therapy places don't spend that kind of time with the patient. Okay, now, as I rub that finger, and I'm rubbing here on the bones of what they call the long bones of the back of the hand. Now, go ahead and close that. Is that improved?
Much improved.
Is it okay when you move that joint? Does that feel a lot freer?
Yeah.
Okay.
That's still the one next to it. That's all I can get.
Okay, so now we're going to work on the front and the back. You got is that a cut or a nick in your?
There's a mole.
It's a mole? Yeah. So I'm going to not try to rub on that mold. Doesn't hurt when I touch it?
No.
If someone had a cut finger or a stitch, well, that would be contraindicated. You know, common sense is something we use a lot of around this clinic. Now, what's interesting as the person administering this therapy to Michael's hand, I can actually feel the tissue when I touch it. It goes from a knotty feeling to a soft feeling. I find it interesting when I shake a man's hand who's a carpenter or a pipe fitter or a welder, and they do a lot of hard work with their hands. I can feel the tension in their hands. And over the years, I've showed many workers, carpenters and other people, how to treat their hands. You know, they may not have pain, but the stiffness in their hands and increasing the flexibility of their hands. Now I'm coming in here. I already worked these a little bit, but I'm coming now. I'm going to work the whole palm of the hand. And when I drag my stick there, it catches right at that point. I come down like this, and right here is where it catches.
When I'm treating myself, a lot of times I'll use the large wedge to do the palm of my hand.
This here?
Yeah.
Yes, you can, well, it's a broader contact.
Kind of a shotgun approach.
And this is, when Chester designed this T-bar, it's brilliant the way he did it. He's got a larger T here versus the smaller, and this rounded point can also be used. You hold on to the stick. But I'm holding on to the small portion like I hold on to a pencil. And it's incredible to me that you can actually feel through the stick itself where the tissue is tight. And then, has that been your experience, Michael?
Oh, yeah.
You can actually get the hang of it.
It's almost like a series of knots or bumps under there. And then as I treat myself with it, you can feel them breaking up or whatever they do. But it relaxes. It'll get smooth. You can tell when enough is enough. It's not a problem.
Now we still have to get the backside of the two fingers that we released. See, I still feel the tension right in here. It's a slow process. You have to be patient. It's and usually you find it lasts a couple of 3 or 4 days before you have to do it again, or a whole week for you right now. When you first started, was it a couple of days?
Yeah, a couple of days, and now I'll do it every week, and sometimes I get a week and a half, 2 weeks.
Now, do you leave the T-bar by your TV set?
Actually,
in the living room?
I have it by my computer.
Oh, so you remember.
I'm sitting there, reading articles, or following Facebook. I'll do it. Make some constructive use of that time.
Now I can feel the tissue.
Crunchiness is probably not the right word, but it pretty well describes the sensation when I'm holding the stick and sliding it over.
And as you do it, it becomes less crunchy.
Oh, yes.
Less
knotted.
Less knotted. Now, the theory of releasing tension surrounding the joints is something that has been known. The Arthritis Foundation of America has a range of motion exercise program for people who have arthritis in different joints of the body. The water is 80 degrees, and they take the joint against the resistance of the water, and they're moving the joint through its range of motion against the resistance of the water. And that has a tendency of relaxing the tendons and the muscles surrounding the knee joint, the ankle joint, the hip joint, the shoulder joints underwater. It's got to be 80-degree water. And I've been certified to do water range of motion exercises by the Arthritis Foundation of America. They have a lot of success with people who are arthritic and moving the joint around in water. This is a specific treatment for the hands. The Arthritis Foundation of America has a range of motion protocol where the hands are in 80 degrees of warm water, and you move the joints through its range of motion in the fingers and in the wrist and the elbow, and you release the tension in there, and that also helps arthritis of the hand and the arthritis of the wrist and arthritis of the elbow and
This
the
is
shoulder.
just so compact and convenient. Makes
Amen.
it easy for me to treat myself.
But that takes several weeks for you to have results with the water range of motion exercise. It takes several weeks. But I just wanted to state that the principle of releasing muscle tension surrounding the joint is something that is known in the health community to be helpful with arthritic conditions. I'm speeding up the process a little. Okay, now close your hand.
Much better. Got one that needs a little more work.
Which one
it's
is that?
Completely.
That one? Okay, that joint.
That's also the trigger finger, the one that locks.
So I'm going to focus in where he explained where he felt the most tension. This is typical what I experience with people with different arthritic conditions. I've had multiple patients over the years utilize this stick and utilize these methods and found it to be very helpful with their arthritis, just as Michael has. It can be done gently on the wrist, and I'm feeling a little knottiness right here in the wrist. Again, the back of the hand the skin is thinner, and you want to be careful not to scratch or do too deeply or rip the skin, tear the skin.
Yeah. Well, that's what I was saying. The parts of the stick that come into contact with the body smooth.
Yeah, it is sanded it's very smooth. And this is, again, poplar wood, a soft wood. Now, you're not trying to go fast on this. Basically, it's a feel. You want to, it's not how fast you do it, it's how you do it. You have to, you'll develop a feel for what feels good to your finger is what you want to do.
You can tell when the knottiness leaves and the tissue is uniformly soft.
Your forearm. Mm-hmm. When we first started, his forearm was much tighter. He's kind of like old lady loose here. It's softened. As I release tension here, release tension in his forearm. If we release tension in the forearm, it will release tension in his hand. As I was trying to demonstrate to you earlier how when you bend your wrist back and you move your fingers back like this or wrist back, you'll see these muscles contract. When you bend your wrists like here, these are what they call the flexors. You bend the wrist there and these muscles contract in here. So as I'm releasing the tension in his hand, I felt a relaxation, a softening of the tension in his forearm. We have nerves that go from our neck down into our shoulder and into our arm, and they cross, the nerves come from the side of the neck down the entire arm and into the hand. And most carpal tunnel surgeries are very successful. Occasionally, you'll have a carpal tunnel surgery that may only be partially successful or maybe not successful. Sometimes the problem, as a chiropractor, the problem is it's not the nerve just being pinched here. It could be pinched in the elbow or the forearm or the upper arm or the shoulder or the neck. And as a chiropractor, we work with both the neck, the shoulder, the elbow, the forearm, as well as the wrist and the hand. And sometimes doing therapy or chiropractic adjustments in the neck and the shoulder, wherever we find an impairment of the nerve supply through our chiropractic evaluation, sometimes that is the solution to a failed carpal tunnel surgery or a partially successful carpal tunnel surgery. It's a surgery that usually has a very positive outcome on a lot of patients, but sometimes when it doesn't, the surgeon was focusing only on the wrist and not following the chain of where it could be impaired.
Much better.
Free of movement.
Yeah, the trigger finger I'll work on tonight, this afternoon. It's not quite as far as the others, but it's much improved.
Okay, so now go ahead and show how you would do it to yourself.
All right. Well, for the back of my hand, I use the broad area. I guess a non-technical way of helping me understand it is the tendons are like strings on a marionette that slide through the tubes, the tunnels in the arm, and when there's a constriction on the either the you can imagine the tube, the tunnel, or the inflammation of the tendon, the string, in other words, it gets sluggish and hangs up. I was a computer draftsman, so I used my hands a lot, as well as some other activities that I had, hobbies, and my hands got an awful lot of use, so that as I've gotten older, I've really had some challenges.
So you're using a broad stick even on the fingers.
Yeah,
We have big hands, though.
Yeah,
You're not a little man.
well, and
A delicate old lady might need the little
Yeah.
T-bar here on this
Well,
end.
I'm also not looking down on my hand from the same perspective that you would, so I'm assured that I'm getting full contact. Now here, sometimes I'll switch and use the rounded end or the narrow end, either way.
You'd work a lot faster than I do.
Well, it's my fingers, and I can feel when the crunchiness, if you were,
Disappears.
Yeah, I can tell when it begins to have an effect. And I can tell just based on the soreness or tenderness of an area how much effort I need to put in on it. And easily tell once it's resolved and I can move on to other areas. For me, it's easier to use the broad end because I'm assured of making contact.
Just for purposes of demonstration, if you would use a little pointy end, and just so they could see that. So that's how.
Yeah,
it's not hard for you to do it to yourself.
No.
It's not a difficult thing.
It's like there, see, I keep slipping off the fingers, so it's a little easier for me on the inside of the fingers
To use the broad
to
end.
use the broad. I have a different point of view than you do while I'm doing this. So, but yeah, a lot of times the area up here on the back of the hand, I'll work that with the smaller end of the apparatus. But I mean, that's a quick and dirty. You don't have, for me, I don't have to spend 30 or 40 minutes. I can do that while I'm watching a YouTube video even.
So that concludes our demonstration of how to utilize this T-bar stick that Chester taught me about 10 years ago, and I've been using it in my practice for the last 10 years. Thank you very much.